Hi everyone, today we'll discuss the recent papers 2017-18 Endodontics. In this series of video, I will later discuss the most recent questions like 1920, 21, 22, all the questions. Now let's start with first question of 2017-18. Subluxation of young permanent tooth. Choice of treatment. Flexible splinting for 2 weeks aid in healing periodontium. B. Flexible splinting for 4 weeks. Rigid splinting for 4 weeks aid in healing of periodontium. Option D. Rigid splinting for 4 weeks. So for subluxation in young permanent tooth, choice of treatment, the answer is A. Flexible splinting for 2 weeks aid in healing periodontium. Next question. A 14-year-old suffers traumatic avulsion of 1-1 and 2-1 while playing hockey and immediately puts them back in socket. He came to your clinic 15 minutes later. The treatment is option A. Remove from socket and reimplant with splint. Option B. Only do physiologic splinting. Option C. Do nothing, and D. Antibiotic and painkiller. Read the question again and read all options. The answer is A. Remove from the socket and reimplant with splint. Next question. Identify what is shown in IOPA. Is it aesthetic post and core, cast metal post and core, pin retent amalgam restoration, or pin retent composite? This seems very easy. The answer is B. Cast metal post and core. Now next question. Question number 4. IOPA image of 11-year-old with injury to central incisor and pulp exposure reported to a dentist. What will be the ideal treatment? You can see the central incisor, the root is not formed properly, and also pulp exposure is there. So the answer of this question is B. Apexogenesis. Apexogenesis. Next question. In a 12-year-old female child, there was avulsion of a tooth which was reimplanted by a nearby dentist. Within 60 minutes, the child has been taken to another dentist after 1 week. What should be done? Option A. Maintain oral hygiene and observe for 3 months. Option B. Remove splint immediately and no other treatment required. Option C. Plan immediate RCT and remove splint. Option D. Splint retent for 4 weeks followed by RCT. The answer is C. Plan immediate RCT and remove splint. Take a snapshot if you want to keep the record. Our next question. A patient is having chronic dull throbbing pain which patient is not able to localize. It is due to option A. A delta fibers, B. C fibers, C. Plexus of Brasco, and D is A beta. Chronic dull throbbing pain and patient is not able to localize. It's a characteristic feature of C fiber. So the answer is B. C fiber. Now 7. DPC is indicated for tooth and the dentist plan for revisit. What will be the material used? MTA, calcium hydroxide, biodentin, formocresol. The answer of this question is MTA. MTA. Next question. C-shaped kernels present in. I'll go to directly the answer. It is the C is the answer. D. D is the answer. C-shaped kernels are present in mandibular second molar, then mandibular first molar and mandibular third molar. Answer is D. Mandibular second molar, then mandibular first molar, then third molar. Option is D. Next question. Which of the following method is used to sterilize gutta percha? Gas sterilization, steam sterilization, ethyl alcohol, quaternary ammonium compounds. The answer of this question is C. Ethyl alcohol. Ethyl alcohol. Next question, question number 10. property exhibited by night eye wires is option A viscoelasticity, option B pseudoelasticity, option D pseudoplasticity, and D non superelasticity. So answer is B pseudoelasticity. Answer is B pseudoelasticity. Now 11 number question, focus. Which of the following is best method to differentiate between periapical abscess and lateral periodontal abscess? Periapical abscess and lateral periodontal abscess. Option A is pulp testing, option B radiographs, option C site of inflammation, option D periodontal probing. The answer is A pulp testing, because in case of periapical abscess you will find non-vital tooth. So the answer is pulp testing, A. Now question number 12, function of sodium hypochlorite, endodontic irrigant within the range of 0.5 to 5.2, bleaching agent, antimicrobial agent, all of the above. Answer is D, all of the above. You can use sodium hypochlorite in all the three options. So answer is D, all of the above. Now focus on 30 number questions. All are true regarding post and core except posts should be placed in the primary roots, like palatal roots of maxillary molars and distal roots of mandibular molars. So this is true. Next, B should not be extended more than 7 mm apical to the origin of the root canal in the base of the pulp chamber. Should not be extended more than 7 mm apical to the origin of the root canal in the base of the pulp chamber. So it is also true. See, each millimeter of increase beyond 1/3 of the root diameter causes a 8-fold increase in the potential of root fracture. Option D, optimal post diameter measurements have been determined to be about 0.6 mm for mandibular incisor. So answer is given here is C. That is false. That is not true. Each millimeter of increase beyond 1/3 of root diameter causes 8-fold increase in the potential of root fracture. So this is wrong. So we'll go to the explanation for better understanding. So here is the explanation. Post length, since 5 mm of gutta percha should be retained apically to ensure a good seal, post should be extended to that length in all tooth except molars. With molars, post should be placed in the primary roots, that is palatal root of maxillary molar and distal roots of mandibular molars. Should not be extended more than 7 mm apical to the origin of the root canal in the base of the pulp chamber. Extension beyond this length can lead to root perforation or only very thin areas of remaining tooth structure. Now post diameter. A frequently used and clinically appropriate guideline for post diameter is to not exceed 1/3 the root diameter. It has been determined that when a root canal is prepared for a post and the diameter is increased beyond 1/3 of the root diameter, the tooth becomes exponentially weaker. Each millimeter of increase beyond 1/3 of the root diameter causes a 6-fold increase in the potential of root fracture. Based on measuring the root dimensions of 1500 teeth, 125 of each teeth, and using the guidelines that the post should be 1/3 of root diameter, optimal post diameter measurements have been determined to be about 0.6 mm for mandibular incisors and 1 mm for maxillary central incisors, maxillary and mandibular canines, and the palatal roots of the maxillary first molar. The recommended post diameter for the other tooth was 0.8 mm. So 6-fold increase, but in the question it was 8-fold, I think. That's why that is not true. Yes, it was 8-fold. So the answer is C. Next question, 40 number question. Zinc oxide in gutta percha, it increases radiopacity, antimicrobial activity, plasticizer. Option D, matrix. The answer is B. Zinc oxide in gutta percha, it has antimicrobial activity. Antimicrobial activity. Now 15 number, endodontic infection is an aerobic, polymicrobial, aerobic or aseptic. The answer is mixed infection, so polymicrobial. Now Ellis and Davies class 4 is, I'll go directly, the answer is B. A traumatized teeth that becomes non-vital with or without a loss of crown structure. So Ellis Davis class 4 is option B, that is the traumatized teeth that becomes non-vital with or without a loss of tooth structure. You need to recapitulate the Ellis classification. Please go to the textbook or explanation part. Now 17, 8-year-old presented with complicated crown fracture, Knowles 7. Few days after injury, pulp responded negative. The treatment is 8-year-old. So there is no root completion and also pulp response is negative. So we have to do apexification. 17. The best option is revascularization. Yeah, the answer is given as revascularization. Okay, I'll go for the B, revascularization, because it's the most recommended. 18. First generation apex locator work on the principle of resistance, impedance, efficiency combined. So the answer of this question is option A, resistance. First generation apex locators work on the principle of resistance. We'll go to the explanation part to see what are the principles of second generation, third and fourth generations. Let's go. So the first generation apex locator, also known as resistance based apex locator, measures opposition to the flow of direct current or resistance. So it is resistance based. Second generation, also known as impedance based apex locator, measures opposition to the flow of alternating current or impedance. So it is impedance based, second generation. And third generation apex locator are similar to the second generation, except that they use multiple frequencies to determine the distance from the end of the cannula. Okay, so here is the explanation part. Now we'll go to the next question. Helical angle. What is helical angle? The answer is A, angle between leading edge and long axis. Leading edge and long axis. Helical angle, option A, angle between leading edge and long axis. 20. In absence of second permanent premolar, the roots of primary second molar will most likely resorb more slowly than normal because there is no second permanent premolar. The resorption will be more slowly than normal. Now 21, root end conditioning is done by citric acid, orthophosphoric acid, formaldehyde, calcium hydroxide. Root end conditioning is done by citric acid. Answer is A, citric acid. Stem cells most commonly harvested from stem cells of apical papilla, stem cells from human exfoliated deciduous teeth, periodontal ligament stem cells, dental pulp stem cells. Answer is D, dental pulp stem cells. Dental pulp stem cells most commonly harvested from. Option D, dental pulp stem cells. Now next question, 23 number question. Statement A is extracanal in mandibular second premolar is measured with only varying 20-degree horizontal angulation. Option B, extracanal in mandibular second premolar is measured with only varying 40-degree horizontal angulation. Option A, only first statement correct. B, only second statement correct. D, both correct and both false. What is the answer? The answer is B, only second statement is correct. So second statement is extracanal in mandibular second premolar is measured with only varying 40-degree horizontal angulation. So the second statement is correct. Now 24, Stropco 27 gauge notch irrigating needle is used to clean and dry pulp chamber floor by sequential use of 5% NaOCl and 17% EDTA, B 17% EDTA and 95% ethanol, 5% NaOCl and 95% ethanol, 2% NaOCl and 95% ethanol. So what is the sequential use of irrigation? His answer is B. In that particular needle, the sequence that is used is answer B, that is 17% EDTA and 95% ethanol. 17% EDTA and 95% ethanol. Now MTAD and tetracline differs in 25 number question. MTAD and tetracline differs in option A, concentration of antibiotic and detergent, option B, concentration of antibiotic and percentage of acid, option C, concentration of antibiotic alone, detergent and percent of acid. The answer of this question is A, concentration of antibiotic and detergent. Concentration of antibiotic and detergent. We will go to the explanation part. Recently, MTAD and tetracline, two new irrigants based on a mixture of antibiotics, citric acid and a detergent, have been developed. MTAD is the first irrigating solution created with is capable of removing both the similar layer and disinfecting the root canal system. It is a mix of 3% doxycycline hyclate, 4.25% citric acid and 0.5% polysorbate 80 or 2-in-80 detergent. MTAD has been recommended in clinical practice as a final rinse after completion of conventional chemomechanical preparation. Tetracline is another combination product similar to MTAD. The two irrigants differs in the concentration of antibiotics. Doxycycline 150 mg per 5 ml for MTAD and 50 mg per 5 ml for tetracline, and a kind of detergent 2-in-80 for MTAD and polypropylene glycol for tetracline. So the difference of these two irrigants is concentration of antibiotic and concentration of and the kind of detergent. Now the next question, 26 number question. Patient come with an avulsed tooth within 60 minutes of trauma. The treatment protocols involve 1.2% chlorhexidine for 5 minutes, minocycline, doxycycline 1 mg per 20 ml for 5 minutes, SNF 8% for 20 minutes, 2% NA for 20 minutes. The answer is B, minocycline, doxycycline 1 mg per 20 ml for 5 minutes. Next question. Corrosion of night eye instruments occurs if immersed in warm NaCl for more than 30 minutes, 60 minutes, 120 minutes, 180 minutes. Answer is B, 60 minutes. Next question. Which of the following procedure is shown in the peak? Apexogenesis, apexification, pulpectomy, pulpotomy. The answer is apexification. Apexification, yes. Now the next question. Which of the following procedure is shown in the radiograph below? This is the picture that we are looking. Direct pulp tapping, Apexogenesis, apexification, pulpectomy. The answer is B. Apexogenesis. Apexogenesis. Identify the correct statement related to given peak. Option A, used to detect caries with help of infrared rays. Option B, used to test vitality with help of AC impedance. Option C, used to detect caries with the help of alternating current impedance spectroscopy. Option D, used to test vitality with help of direct current. The answer is C, used to detect caries with the help of alternating current impedance spectroscopy. Now the next question, on a tooth after bleaching, a minimum time gap required to place composite resin restoration without affecting its strength. Immediately after bleaching, after 1 week, after 2 weeks, after 4 weeks. Answer is B, after 1 week. Number question, concussion in maxillary anteriors due to trauma shows sensitive to percussion, bleeding from gum, spontaneous pain, negative result from pulp testing. 32 is A. Concussion in maxillary anteriors due to trauma shows sensitivity to percussion. Now 33 number question, type 3 isthmus as described according to Kim's classification is. Answer is C, very short complete isthmus between two canals. Very short complete isthmus between two canals. Next question, mid-treatment emergencies in endodontics are seen maximum in RCT of vital tooth, RCT of non-vital tooth, traumatic injury tooth, RCT without antibiotic prophylaxis. Flare up, actually the question is talking about flare up. The answer is B, in my opinion. Yes, answer is B, RCT of non-vital tooth. Often we see that there are flare up. Now 35, tooth sensitivity. Tooth is sensitive to hot and relieved by cold is most likely suffering from partial pulp necrosis. Answer is partial pulp necrosis. So tooth is sensitive to hot and relieved by cold is most likely suffering from, the answer is B, partial pulp necrosis. Now the next question, in pulpal pathology most common organism involved are gram positive, polymicrobial anaerobic, mostly aerobic, gram negative. Answer is B, polymicrobial anaerobic. 37, blood supply to pulp. Fenestrated capillaries, sinusoidal vessels, precapillaries, postcapillaries. The answer is A, fenestrated capillaries. 38, which component of triple antibiotic paste is responsible for staining teeth? The answer is C, minocycline. Minocycline. The 39 number question, injury which is not strong enough to cause serious visible damage to the tooth and the periodontal structure, concussion, subluxation, avulsion, ankylosis. The answer is A, 39A, concussion. Now the last question of this series, best method to diagnose non-odontogenic pain. Best method to diagnose non-odontogenic pain. Visual and tactile, percussion of teeth, radiographic analysis, case history recording, step-by-step testing and evaluation of case. The answer is D, case history recording, step-by-step testing and evaluation of case. So here we complete the 2017 and 18 recent questions. Now next video we will discuss 2019 and 20 recent year questions. Thank you very much.